Good morning, good afternoon and good evening, and a very warm welcome to this Mott MacDonald Global webinar. I'm Simon Harrison, Head of Group Strategy for Mott MacDonald, and thank you for making the time to join us today, wherever you are in the world. COVID-19 has affected us all, both personally and in our professional lives, but in different ways around the world. As vaccines offer hope of a way out, their uneven distribution globally, together with a range of other factors, will mean the nature of the exit varies place by place. How do we make sense of this when plotting the future paths for our organisations and businesses? It feels like driving through fog. Mott MacDonald unusually has teams of health professionals, including epidemiologists, who have applied the skills they normally deploy in solving a range of global health problems to the challenges infrastructure and other operators face as they navigate this strange world. We have science-based independent insight into how things are likely to evolve. And working with our infrastructure professionals, our health professionals have created this webinar as a contribution to a greater understanding of how we all need to respond. I'm delighted we have a global audience today, which creates a wonderful opportunity for us all to share experiences. Although inevitably this means we will have to gloss over the particular ways in which different countries are handling matters. Our presenters will be speaking for about 20 minutes, after which we plan an extended period of questions and answers. Please do ask questions or like others' questions in the chat. And if you do ask a question, please mention which country you are based in so we can understand your context. Our teams will also be pleased to hear from you after the event. Contact details will be given at the end. We're recording the session today and will make the recording available to all participants. I'd now like to introduce Dr. Anthony Hazar, who will introduce the topic for today's discussion. Anthony, thank you.
Thank you, Simon, and good day everyone wherever you are in the world. My name is Anthony Hazar, as Simon explained. I'm a medical doctor by background, working on infectious diseases and health security. Like for you, the pandemic has changed the way that we work, and over the past year, we've been trying to help people pick their way through the science and the challenges that have come with COVID-19. I'm joined by my health colleagues Javier Martinez and Chelsea Stefanska, who will introduce themselves in due course. To set the context, there are many questions on our minds. Some are related to us as individuals, some related to work and our businesses. Some are based on news of new variants, others on optimism as vaccines are rolled out. There are many questions. As you may have guessed, the reality is that there are no straightforward answers to these questions, particularly in a global context. So, rather than trying to answer each question specifically, since what we predict today may be completely different in a week, we'll focus instead on the different factors, or what we call the variables, that can impact the course of the pandemic in the coming months. Understanding these variables can then help us to prepare scenarios to make better informed predictions. So hopefully, by the end of this prediction, we'll enable you to stay one step ahead. We'll discuss the key variables, provide some examples of how this might affect us all, and consider the challenges and opportunities that they present. By going through this process, we hope that you will have a better appreciation of some of the complexities, be able to plan more appropriately, to manage risk, and to improve your resilience to future infectious disease threats. I'll now hand over to my colleague Chelsea Stefanska, one of our in-house epidemiologists, to go through each variable one by one in a bit more detail. Chelsea?
Hello everyone, I'm Chelsea Stefanska. I'm an infectious disease epidemiologist on Mott MacDonald's global health team. So these are the key variables that we'll go over today. Basically, what we want to emphasize is there's not a straight path to the finish line. There are multiple variables and factors that we should be considering when trying to plan ahead. And these factors can be broadly grouped into two categories. The purple boxes we're calling epidemiological variables, and the orange ones are more contextual variables. It's a fuzzy line, but we're thinking about the purple ones as more scientific, and the orange ones are more human context. And today we'll demonstrate why predictions have more value when applied to a national context rather than globally. The first of these is new variants. New mutated versions of a virus tend to pop up by chance where there's a lot of transmission happening. It's totally normal for viruses to mutate. It's how they evolve. So to give you an idea of how often viruses mutate, there are actually over 4,000 different variations of the virus that causes COVID-19, but most of these are very small, inconsequential changes. Mutations in the genetic code happen randomly, and most of them are irrelevant. But when there is an advantageous change, these mutations tend to be passed on and predominate over other variants. We already have variants that increase transmissibility, making the virus harder to contain, and some variants may make current vaccines less effective. And so these new variants could cause cases to start rising again, even where vaccine coverage is high. This may impact mobility and travel throughout this year, depending where the concerning variants are. And this could potentially become even more extreme if new variants pop up that make current vaccines much less effective. Vaccines are providing the most optimism in the pandemic and will undoubtedly be a key element in coming out of it, but there are still some hurdles and unknowns. For example, the duration of protection is still unknown, so it's very likely that booster doses will be required periodically, and these boosters may need to be tailored to new variants. We know that all the current vaccines protect very effectively against severe disease and death, but we still don't know for sure if the vaccines protect against transmission of the virus, though some have shown promising early evidence. There are also challenges with equitable distributions of vaccines during this early period of limited supply, most of which has so far gone to high-income countries and left many low and middle-income countries without sufficient stock of vaccine. This may be alleviated by expanding the IP and manufacturing rights so that the vaccines can be produced in more locations, which is an ongoing heated global debate, but so far it hasn't happened. The evidence is evolving, but until we know more definitively, it's really safest to assume that vaccinated people may still be able to transmit the virus to others. On a positive note, the longer that this pandemic drags on, the more we're learning about the clinical course of the disease, meaning how it progresses in infected people. And as we've seen, this can vary drastically with a wide spectrum of symptoms. We already know about some risk factors like older age and chronic diseases, but that doesn't explain why some healthy young people become severely ill and die, or why some people are sick for months, suffering with long COVID. And these are the puzzles that are slowly being pieced together. So when scientists and clinicians do eventually solve these mysteries, which I believe is really just a matter of time, it can hopefully open opportunities for better and more targeted treatment and prevention. Different parts of the world are at very different stages of the pandemic. Some countries are struggling to contain the latest wave, others have it more under control. Some countries will achieve substantial vaccine coverage before others have even given their first few doses. And where the pandemic is uncontrolled, new, more vaccine-resistant variants are more likely to occur, which could set back global progress. These differences between countries will continue to affect border restrictions, travel requirements, and there's a lot of ongoing discussion right now on vaccination passports to help enable international travel. So the pandemic has really demonstrated how interconnected the world is. One country's protection depends also on how other countries that they have close links with are able to control kind of almost their share of the pandemic. And so we really mustn't let our guard down if it seems like where we live or where we operate is doing well. The political systems and the ways in which government decision makers act on information is a key variable to predict impact of the pandemic in each country. As we've seen, sometimes in very extreme cases, the same evidence can lead to very different courses of action because decision makers are influenced by multiple inputs, not only by the science. Plus, national interests are not always the same as global interests. We've seen this throughout the pandemic. Earlier on, there was banning PPE exports. Some countries had sufficient supplies while others didn't even have enough PPE for their frontline healthcare workers. And now we see vaccine diplomacy with some countries stepping in to offer vaccines to low and middle income countries that don't have supply access, while others are buying up these limited supplies for only their own populations. And it's becoming an interesting new form of diplomatic currency. And so the implication for all of this politics and governance is that while we can use advocacy to influence decision makers to an extent, for example, for personal or business interests, we do need to work within the regulations being applied in each country, which could affect office or business reopening, for example. Economics. A country's wealth and economic stability have largely determined the response to the pandemic, whether that's through subsidies or benefits packages or purchasing power for vaccines. Cost-benefit analyses help with decision making. Some analyses are much simpler, where a modest investment yields a very high return, like face masks. But in most cases, it's much more complex, where economic activity is affected. For example, policies about closing businesses. But with all of these cost-benefit analyses, one which really stands out is investing in improved preparedness for infectious disease threats. Looking back at what would have helped at the beginning of the pandemic can better prepare us for the future. And this cuts across all types of sectors and projects and could open opportunities to achieve greater resilience against infectious disease threats that will come in the future. National health systems have been pushed to their limits, or some above their limits or far over their limits during the pandemic. Many countries don't have universal access to affordable, good quality care, which may complicate vaccine rollout. The focus on COVID-19 has also pushed back other needs like cancer screening and routine surgeries, which will take quite a long time to catch up in the recovery process. And the health workforce has suffered mentally and physically during this pandemic. So we really need to make sure that we take care of our health workforce as well. The implication for businesses is that more restrictions get put in place when the health system is overwhelmed. So we really need to keep an eye on the response capacity by the national health systems in the countries where we're working. And last but not least, human behavior. So human behavior, which can be rooted in social and cultural values, has played and will continue to play a key role in 2021 and beyond. After all, the pandemic is shaped by how people respond to it. There's fatigue, frustration, and uncertainty about the future. So compliance and confidence are two key issues to watch, and also we can try to influence with good communications. This brings opportunities for improving social outcomes. Now my colleague Javier Martinez will take over and show you some practical ways of using these different variables in your work. So Javier, over to you.
Thank you, Chelsea, and hello, everyone. My name is Javier Martinez. I'm a public health physician working in Mott MacDonald's global health team. In the next few slides, I will try to provide some examples of how we can use the variables. You may find that some of the examples are a bit generic. They become more relevant the moment they are applied to our local context. In considering the variables together, we can make some informed decisions, predictions or forecasts about how things may unfold in general terms over 2021. This is useful to know because it can help us manage risks as individuals and also as businesses. We are aware that some of these predictions may seem more relevant to those among us based or operating in the European or North American regions. For your specific sectors, region, and context, additional adaptation may be required. One very important implication for 2021 that we are already beginning to witness in a few countries is a reduction in the enormous pressure and burden that COVID-19 has imposed on our healthcare systems. As vaccination coverage increases, there will be more room for the healthcare system to do less COVID and manage the backlog of non-COVID related conditions to be treated. The relaxation will be incremental, and it will also contribute to mitigate societal, medical, and political concerns of overwhelming our healthcare staff and facilities. We also expect to see an increase in attention to infectious diseases, including more surveillance in countries that can afford to invest now in order to be better prepared than we were 1 year ago. Apart from strengthening lab capacity, we could see opportunities in the wastewater sector for early detection of new threats even before symptoms are detected among the population. People will continue to be afraid for some time, and we expect several infection prevention and control measures to become common or even standardized across many sectors. Mass vaccination, where this is attained, will incrementally achieve what is perhaps the most important change required of all, a change in the mindset of our societies, that COVID-19 can be controlled, that it is safe to resume certain activities, with precautions and vigilance being observed. This increased confidence will enhance, for example, the resumption of office work, with remote working becoming still relevant, domestic travel and outdoor spectator events also gaining pace in the coming months. Large indoor events and international travel, on the other hand, could take longer to recover. For as long as access to vaccines remains unequal, large spectator events might represent the risk of new variants that could be resistant to current vaccines entering our more vaccinated countries. In sum, the gradual easing of some restrictions will take place alongside new and old challenges, depending on how quickly and effectively we are able to get the pandemic under control. Pandemic control is not the disappearance of the virus, but its containment and control, similar to how we are keeping under control viral infections like measles or polio. There is some way to go to get to that point. In this slide, we have prioritized 3 implications that cut across most sectors. Depending on our context, these implications can represent both challenges, but also opportunities. The first implication is the need to strengthen health and safety protocols to better protect our colleagues, staff, and customers. We are beginning to see this requirement built into tenders, feasibility studies, due diligence, and project management arrangements where, for example, international travel or work in project sites are required. It will require extra work, keeping up with the science and regulations, but it's also an opportunity to ensure well-being is prioritized. A second implication is the need to incorporate digital technologies and new ways of working to make our projects and services more accessible and safer. Digital solutions can reduce queues and crowding, and contactless technology can reduce the risk of disease transmission, just to mention 2 examples. In Mott MacDonald, we also focus on connected thinking and social outcomes, and we are increasingly applying this concept to achieve, for example, healthier cities, where citizens can more easily adopt healthier lifestyles through more accessible, better integrated, and safer infrastructure and services. Healthy cities is a relevant example when discussing the implications of the pandemic, because cities bring many people together, thus increasing the risk of transmission. Lastly, the most important implication of this pandemic, particularly as COVID-19 is not a one-off, is the need to build pandemic or epidemic resilience into all our projects, infrastructure, and services. For the one thing we can predict is that there will be new disease threats coming our way in the not too distant future, and pandemic resilience will help us better deal with those. So what is pandemic resilience? Pandemic resilience is about learning the lessons from COVID-19 and adapting present and future infrastructure and services to the infectious disease threats to be faced in the short to medium term. We have developed our own approach to pandemic resilience in 3 steps. The first one is about reducing the baseline risk of disease transmission where that is possible, through, for example, measures that improve ventilation or better manage crowding or enable contactless features. A second step is ensuring that we can adapt by, for example, putting contingency plans in place. This is one area where the variables can help us consider various scenarios, but we must remember that the next epidemic or pandemic may have different transmission characteristics and may not be through the air. The third step is to preempt and enable our infrastructure to change its function if and where necessary. We believe and are pushing for pandemic resilience to become an industry standard, in the same way that fire safety and carbon neutrality have become new standards. Pandemic resilience ultimately aims at protecting people, enabling continuity of services, and reducing the potential economic losses caused by epidemics. These have just been a few examples of using the variables to make more informed predictions and better manage risks. But please bear in mind that the more you apply the variables to your specific trade and context, the more relevant those predictions and scenarios will become. If you are interested to know more about pandemic resilience, please visit the site mentioned in the slide on the right-hand side, where you can find some of our materials. And this is all from us. Thank you very much for joining us today, and we look forward to your questions and comments. Please like any questions so that we know which are more popular. And now over to you, Anthony.
Great, thank you, Javier, and thank you, Chelsea, as well for your contributions and presentation that we've just listened to. We've got some questions in the chat window. Can I encourage those who have joined to pop any questions that they've got into the box at the bottom for it to be published, and also to, as Javier mentioned, to like any questions that have already been asked. I'll just start at the top and work down after that, but starting at the top with Javier first, I think. This is a question for you. So the question is from the UK, from Andy Pitts. Given the virus is causing given that the virus causing COVID-19 will keep on circulating around the world for years, does that mean we could face another pandemic of it?
Sorry, the old trick of you are muted. I was saying that's a very good question. Yes, we could. It is possible. I don't think it's going to happen causing one pandemic after another. In a way, we are already in a pandemic, and it may become what we call endemic in some parts of the world. That's going to depend on all the factors we were referring to, whether there is sufficient vaccination, whether vaccination can cut transmission, and so on and so forth. But what I think will happen is that we will be able to go back to something like our previous lives. They will not be identical. There will be new things that we will have to do and new requirements that will be imposed. But we will all understand, unlike at the beginning of this pandemic, why these measures are necessary. And if we are effective in containing and controlling the epidemic, the pandemic, we should be able to not have very large outbreaks. But the risk is there. As long as there are variants that can become resistant to existing vaccines, there is always a risk that those variants get into places where vaccinated people can get the disease again, another variant of the disease. And we don't yet know to what effect. Whether it will be the same level of disease or it will be a lighter one, it's too early to know that. But yeah, I think that's a long answer to a very good question, Andy.
Great, thanks, Javier. So the next question, or next series of questions, is to do with the vaccine passports, and I know this is something that Chelsea has been looking into recently. So the two questions that I think would be good for you to answer, Chelsea, are from Laddie Irian, who I believe is from the US, saying thanks, interested in learning more about health passports process and possibilities. And another question from A, not sure who that is, asking why the World Health Organization urging caution against vaccine passports. I think the two are related. Over to you, Chelsea.
Yes, great. Great questions. Vaccine passports are a huge kind of contentious issue right now, but also hugely important for opening up and enabling tourism and international travel again. And so one of the biggest issues during this current period, where there's very limited supply and it's very unequal and inequitable across different countries and continents, and there's a big kind of split between high income countries and the low and middle income countries, is that it's just an ethical issue first and foremost, that you're then kind of enabling people who have access to these vaccines just based on the country where they live and the fact that they were born in a rich country, whereas people whose countries don't have access to vaccines yet are automatically kind of excluded from all of these opportunities. And so there's the ethical issues, but then there's also scientific issues, that there's still a lot of unknowns, like that we're not actually sure how long the duration of protection is, not sure if someone who's vaccinated can still transmit the virus, not sure if there's any differences between the vaccines on these things. So it could be that certain vaccines have different characteristics than others. And all of this kind of needs to be ironed out, I think, for the World Health Organization to be more confident in recommending this. So this is something that is just unclear at this point. Another issue is all of the data security and privacy and technological issues. And so if it's going to be a digital vaccination certificate, which we expect that's what it's going to be, with a paper option for those who don't have smartphones, then there needs to be some sort of consensus on all these sort of privacy issues, security issues, authentication, the data exchange between countries, and that's not quite easy to achieve a global consensus. And so there is a World Health Organization working group for smart vaccination certificates. I'll post the link to their page in the question Q&A box, but there's so much discussion that's ongoing, and I think it's probably inevitable at this point, because some countries are already recommending these despite not having necessarily a global consensus. There's certain countries that already have their own vaccination certificates that are enabling people to go to events or to, I don't know, I guess mostly events, but the international travel. There's some corridors opening up in between different European countries, where if you've been vaccinated from one country, you can now visit another. And I think it's really going to be a challenge of agreement and consensus between countries at this point for the time being, before it becomes more universally accessible to get vaccinated. That was a long answer, but I hope it answered the question.
Great, thanks, Chelsea. And if within what Chelsea or Javier have said, that's prompted other questions, please feel free to pop those questions into the box as well. We've got a question here from Nick. I'm not sure where Nick is dialing in from. This is a question for Javier, I think, about return of investments and I guess the threat of future pandemics. So the question is, to achieve a return on investment, I suspect you need to believe that there will be further pandemics in the future. Is some of this too late for the current COVID-19 pandemic, given the emergence of vaccines? Javier? You're on mute, Javier.
Thank you, Anthony, and thank you, Nick, for the question. Well, to achieve a return on investment on what is what I would like to understand better, but I will try to answer the question. You are right. we need to believe that there will be new epidemics and pandemics in the future. COVID-19 has not been the first one. In previous years, in the last decade, we have been through several regionally important pandemics. Remember SARS and MERS, and then Zika in Latin American countries. So COVID-19 just was the big one, the one that hit us harder. But there will be more. They may not be viral, all of them, or there may be different types of viruses that affect us. And yes, in order to better prepare for the future, we will need to understand the epidemiology of those specific diseases. So we are already applying that way of thinking in the context of COVID-19. When we are working, for example, to give you an example from our own work, we sit in many engagements with our colleagues from, transport sector, for example, and with their clients. And in the first part of the pandemic, we were working with them on how could they reopen safely their infrastructures. We then began to work with them on whether they could introduce new innovative features in the way they manage their infrastructure or services. And now we are working in some fields in order to look at the future designs of future infrastructures. So we are already thinking about pandemics being a reality that we will have to face. And I think we will be much better prepared in the future than we were only 10 months ago or 1 year ago. So in a way, COVID-19 has had one very positive effect, which is that it has made us understand that epidemics are not something for the medical cadres to deal with. Epidemics are something that can very substantially alter our lives in ways that we had not thought about, and therefore that all of us at all levels, businesses, individuals, families, etc., need to be better prepared for it. I'm not sure that I have answered your question in the way you expected. And if I haven't, please feel free to drop another one on where exactly you would like to see that return on investment. Thank you.
Thank you, Javier. And if I can keep with you just to ask the second part of that question, it's not in the question from Nick directly, but I'm curious to know what are your thoughts on antimicrobial resistance? I know some people have declared that it's a slow burn pandemic. For those of us joining the call who don't know what antimicrobial resistance is, this is where antimicrobial drugs such as antibiotics no longer work because the bugs have developed a mutation that means that they can escape the effects of the drug. So it's something that already exists. It's part of evolution, but it's growing. There's a growing concern about what it means to future health and healthcare and to us in the world. So Javier, do you have any thoughts on that?
Well, I have a few thoughts. Let me try to put this in some order. So the first thing to say is antimicrobial resistance and epidemics are different, but they share many common features. For example, both of them have become more prevalent, or they have accelerated as a result of damage to ecosystems, damage to the environment. So many measures that we can take in order to reduce the impact of epidemics would also reduce the impact on antimicrobial resistance. Antimicrobial resistance is something that requires interventions at various levels, the most important of which is that we need two things. We need new antibiotics, but more importantly, we need to use existing antibiotics much better than we do. That in itself would deal with a number of problems. We need to stop dumping antibiotics into animals and from animals to the environment and from the environment to us. So that vicious cycle, that damage to the environment is one of the factors causing antimicrobial resistance to be the problem it has become nowadays. There are many parallels. Anything that we do, for example, in contactless technology is also going to reduce the risk of certain bacteria to be transmitted from one person to another. So as I said, there are many parallels in there. There are more, but these are the ones I can think of now.
Great, thanks, Javier. We've got a question from Michael Plunkett from the UK. This is one for Chelsea, I think. What types of transmission for any future epidemics pose the greatest challenge to contain? For example, airborne versus waterborne, etc. I imagine there are a few others in there, like through touch and bodily fluids like Ebola as well, potentially. So over to you, Chelsea.
Wow, great question. I love this question. It is something that I could probably talk about for a long time, but I'll try to keep it short. I don't have something that I can reference to back this up, but I'm sure there's a lot of resources. But based on what I understand, I think that airborne is probably the most challenging. And I was absolutely dreading when I got my master's in control of infectious diseases, and I had discussions about this, you know, just lunchtime chats, and I was absolutely dreading an airborne pandemic because this relies so much on human behavior and compliance and all of these things that scientists can't just give people a prophylactic pill or something, I don't know, something a bit easier. It's all about people complying with things that in some countries, including my own country of the US, many people believe, you know, impact their civil liberties, things like that. And so it's extremely difficult because an airborne virus or bacteria, some sort of airborne pathogen, can be spread so easily, and especially one that can be spread while it's asymptomatic. So this is another thing. Yeah, having a lot of fun here. So if you've got a disease that can be spread while it's asymptomatic, that, you know, compounds this transmissibility because people won't know that they're spreading the disease. And so if you've got something like I believe Ebola, where you don't spread it until you're symptomatic, that's, although it may not seem like it, actually a lot easier to contain because you don't have people just walking around casually chatting to people and spreading the disease. Whereas with an airborne disease, you do have that, especially, well, the asymptomatic airborne diseases. And so that makes it very difficult. But then again, you have diseases, viruses like HIV, which theoretically should be a lot easier to contain because they're not that easy to transmit, really. But you know, it just got completely out of control. Global pandemic of HIV that you know, you don't spread by shaking hands or close contact. You don't spread by talking to someone, and yet it's become completely, you know, this global pandemic that's out of control that kills people, you know, by the millions. And so I would love to say that we should just worry about airborne diseases, but that is absolutely not true because also outbreaks of cholera, you know, just completely wipe out. All right, I'm getting a little too excited, but the point is that what is the point? I think there's a lot of complicated answers to this question, but I think that the airborne and asymptomatic is what I worry most about, which is exactly what we're dealing with, which is exactly why it's so hard to contain. But that's not to say that other transmission routes are actually any easier, because even easier, theoretically easier things to contain get completely out of control. Thank you for listening to my TED Talk.
Thanks. Thank you very much, Chelsea. And I guess, you know, that speaks to some of the contingency planning scenario work that Javier mentioned in his part of the presentation, where we can think through the different types of transmission routes in order to improve pandemic resilience for different infrastructure settings. And kind of related to this, you know, Chelsea spoke about the importance of airborne transmission. And Simon, I wondered whether you might be able to speak to this question, which isn't published here, but it's a question that I hear quite a lot. Is there a role for infrastructure regulators to build in some of these, I guess, pandemic resilient features, so improved ventilation, the need to go contactless or touchless rather than having people share surfaces, etc. Is there a role for that in the sort of the construction building environment?
I can imagine that there could be. And we'll we'll have to see how things evolve in different countries. For me, it feels as if it might be a form of health and safety regulation. So it then becomes regulation that isn't applied only to infrastructure, but to any setting where those kind of risks might exist. So I'm guessing that it might go in that direction. The other forms of infrastructure regulation, which are typically couched in economic terms, it might be used as some kind of instrument, but to me that feels perhaps less appropriate than a consideration of it in a health and safety setting. But I imagine each country will be taking its own perspective on this. There will no doubt in time be pushback around cost, and human nature is a dreadful thing at forgetting, isn't it? It's there'll be something else along and attention will turn elsewhere. So I think the answer for those of us who care about this actually is to make a noise now while it is still high in everybody's mind, and try and get the thinking and maybe some of the action advanced quickly.
Great, thanks, Simon. And I think that's one of the positives that's come out of this tragedy, is that it's focused the mind, or helped to focus the mind on infectious disease threats. Okay, I'll move on to the next question here from an anonymous person, but it's got a like. I think I'll hand this over to Javier. What does it mean that we have achieved control of COVID-19 in practical terms? Can you offer an example?
Yes, thank you. So to say that we have controlled COVID-19 will mean that we are able to manage outbreaks and prevent these outbreaks from becoming too large, from spreading to other countries, or to spread within our own societies. In other words, it means to have an effective containment and control. And that means that once we achieve sufficient level of vaccination, the role of the healthcare system to trace new patients, the role of research to trace new variants will become paramount if we want to really achieve control. Perhaps it's easier to understand if I provide an example of a very different disease. Measles is another viral disease that we have known for many years. It affects children. Many of us have, particularly people my age, had measles when they were kids, and we never thought that it was too serious, but measles can kill many people, particularly in the developing world, in low and middle income countries, where measles can really cause very high mortality. Now, we haven't seen measles in our countries for many years, but then more recently, in the last decade, you may have read in the news that there were cases of measles in America or in one part of the world where it hadn't been seen for many years. Why is that? Well, because we lowered our guard, because we allowed people to say, well, I don't really want to vaccinate my children. I don't think it's necessary, blah, blah, blah. And yet we know that if we don't achieve a high level of vaccination, measles is more transmissible, more contagious than COVID-19. If we don't achieve high level of coverage with the measles vaccine, we may go back to having measles outbreaks around the world. So in order to keep that at bay, we need to use the tools that science have provided us. It will be exactly the same with COVID. We will be able to go to our more normal lives, but that doesn't mean that we will live as if COVID didn't exist. For several years, I'm afraid, we will have to keep on watching how the pandemic evolves and how we respond to it.
Great, thank you, Javier. We have a question here from René Laboucharny. Sorry if I've mispronounced that. So this is one for Chelsea, I think, about sort of control of diseases. We have so many anti-vaxxers in the world. how are we going to contain the virus when people refuse to get vaccinated? So I guess this asks the question is, do all diseases need vaccinations? And there's probably examples of a number that don't. What's your take on this, Chelsea?
Ooh, I'm going to try to not get as passionate about anti-vaxxers as I did about epidemics and pandemics, but this is a huge problem. There's, the anti-vaccination movement is an industry now. They've got billions of dollars of funding, and they're extremely coordinated. They know, behavioral science research. It's very intentional, and it's very targeted. And I've seen some of this in my own family, how clever some of the kind of methods that they use to get to people. It's very subtle, kind of planting things in your head and building it over time. And it's extremely difficult. But I've posted a link on your question, actually, there's a WHO, another WHO, I'm not sure if you'd call it a working group or I suppose it's a network, but it's for combating the infodemic. So I'm sure people have heard that phrase. It's the kind of epidemic of misinformation. It's the infodemic. And so there's a lot of research going on now. There have been online conferences about this, and plenty of research is really going into how to effectively combat this misinformation when people don't even see the same news. There have been analyses of people's social networks on Twitter and things like that, and all of the anti-vax stuff is over here, and all of the real science is over here, and the people who follow this stuff don't even see the other side. It's extremely difficult to make people kind of interact and make people see the other side, and so I don't have a great answer. There's no simple answer. It's extremely complicated. But if you look at that website, there's also a newsletter that they send out with some papers and ideas and case studies on, and sometimes they have webinars and things of what's worked in certain parts of the world. Some cities have done communications campaigns, and there's a lot of work on kind of public trust, and a lot of work on kind of effective communications within the community, coming from the community, not coming from this abstract government source over here that no one's ever talked to, and who knows what their motives are. But if you engage local community leaders, things like that, and get kind of on the ground where people trust information sources, that's been a big strategy to try and gain trust in the science and the vaccines and treatments and things like that. And there was also a lot of research done on this during the Ebola outbreak, because there was a lot of kind of rumors out there that that treatments centers were killing people, that there was a lot of damage being done to people's families, and that people were being kidnapped, things like this. And like a white person coming in a hazmat suit and saying, "That's not true, trust me," is not the solution. And so it involves a lot of kind of complex societal and behavioral integration with and communication, and sorry, another long-winded answer from me, but there you go. Check out that website that I posted, and it's basically it's a complicated, very tricky question to kind of engage with this. Wait, one more thing. Something that I read that I've found extremely useful in my own discussions with people in my family or friends that have hesitancy about vaccines is not to group everyone in like you're a crazy conspiracy theorist, because there's people who are anti-vaxxers, and there are those kind of conspiracy theorist heavy, like there's microchips in the vaccine, and then there's just vaccine hesitant people who are kind of on the fence, and there's a lot more of those people who just may not necessarily know what is good information and how to look for that good information. And so by engaging with those people in like an understanding way, and not treating them like they're crazy or they're stupid, and just kind of engaging with them like you'd have a normal conversation with a good friend, and not being condescending or anything like that. It's really important to just be on people's level and talk to them, and provide information if they ask for it, and if they don't try to force it. Thank you.
Just to complete, just to add one point on that, one of the most difficult things during this pandemic has been to manage information. And if we, who are public health professionals, struggle with finding the right information, correct information, science-based information, just imagine what it must be like for many people who do not have access to that. So we have to understand, as Chelsea was saying, that some people may be simply hesitant. They may have heard this, they may have heard that. The reality is, when you look at the current track record of these vaccines, that they have produced much fewer side effects than many other drugs that we use every day have caused over the years, including some analgesics that we take for a headache or a pain or whatever. So yeah, misinformation, handling that has been a big part of the pandemic. And I hope that's another lesson that we will learn in the future, that it's important to know where you get your information from.
Great, thank you both for your insights there. I think this might be perhaps the last question before we wrap up. I think we'll pass it over to Javier first, and then maybe Simon to share any insights from other industries and other sectors as well. So the question's from John Reevy. Why does each country have to research, certify and approve a vaccine independently? To speed rollout, could the WHO centralize this? How can we get the EMA, FDA, CFDA working together? It was disappointing to hear the challenges against AstraZeneca in the past couple of weeks, which has created a negative outlook in some countries. So I think this is about regulation. How can we get people on the same page? So Javier first, and then maybe Simon to share some insights from other sectors.
I think, John, I think this is really a very good question, and I don't have an answer to give you. I was going to say the reason why this is happening is because we live in the world that we live, and the world is the way it is, not the way we would like it to be. So yes, unfortunately, national sovereignty can come in the way, very often it does, of achieving better results, faster results, etc. WHO, well, WHO has the authority that member countries give it. WHO is the one being blamed very often for lots of the things that happen around the world. Remember, think about Ebola, you know, WHO were accused of having a very slow response, this, that, and the other. The reality is that WHO have been following this pandemic from the beginning. I think they did as best they could at the time of announcing that this was an epidemic of real concern. And it would be good if, as you say, WHO could act and could become the kind of the sole judge. But many countries are not prepared to achieve that. And the other point to consider is WHO has a role to play, and that role should not mix with what other agencies can do better. So our European drug agencies and American, etc., they are very well organized to do that. They are well funded by their countries, which WHO is not always well funded. So my answer to your question is, I wish it could be like that, but it is the way it is. That is why the political situation, geopolitics, plays such an important role at the time of understanding how will the pandemic evolve. Simon.
Well, I can only agree with Javier. You only have to look at things like climate change politics, I think, to see a close parallel. Individual nation states will see a vested interest for themselves. Individual politicians and political parties within nation states will see advantage within their own countries to behave in a particular way. And we've seen that in the way that we've frankly had pretty poor knowledge sharing around the world. You know, there was some really good practice in places like Korea, which everybody had simply copied, would have made this much more straightforward. But I think you see that in all walks of life, and achieving global political consensus quickly is very, very, very difficult. Even if any rational person would say it should be done, it's just not how people work. And when you look at why that is, it comes back to democratic accountability. People in democracies elect their politicians to act in their interests, and quite often actually get pretty upset if those politicians are perceived to put their country and them at a disadvantage in favour of somebody else. So it's a very, very kind of difficult issue that, as Javier kind of implied, perhaps is more an artifact of our collective human nature than anything else. So it's a very human failing is perhaps the way to think about it.
Great, thank you, Simon. And in many ways, I think it sort of brings us back round to the topic of this conversation, which is that there are many variables that affect the course of the pandemic. Some of it is related to the virus, some of it's related to vaccines, and there are others that are related to human behaviour, confidence in taking the vaccine, compliance with regulations, but also geopolitics and economics. So I think that's a nice way to round off the session. Thank you everybody for your engagement and all your questions today. I think we managed to cover most of the questions in the chat window, but if there are any that we've missed, we'll try to follow up afterwards and answer anything that was unanswered. In any case, we'll share the recording with the follow-up email in the next couple of days. In the meantime, please do contact us or whoever you know at Mott MacDonald if you wish to discuss anything further. I'll hand over now to Simon to give his closing remarks. Thank you, everybody.
Thank you, Anthony, and a really big thank you to Anthony, to Chelsea, to Javier for a really rich discussion, and to all of you for asking such great questions. And I bet you didn't think you could get a free TED Talk, so that was wonderful. And so I think it's, for me, been a fascinating exchange, and all the more so for coming from around the world and seeing those different perspectives coming through in your questions. So it remains to me really just to wrap things up by wishing you all well, and let us hope that things move forward progressively with the vaccines, that vaccines become more equitably distributed around the world, and that we all move beyond this and learn from it in the best possible way. So thank you very much indeed. Bye-bye.
Thank you, everyone.
Thank you.